Yes, so I hope you're having a good morning. Welcome to our CME series. My name is Andreahl Millenia. I'm a level 6 medical student at the University of Nairobi. My interests are in public health and global health, as well as innovation in healthcare. So today I have the pleasure of being a moderator for this amazing session on human papillomavirus. So this CME session is a part of a student-led initiative called XYZ which aims to revolutionize learning and enhance understanding of various medical topics, all while maintaining a friendly, inclusive, and engaging environment. So through this platform, we hope to encourage curiosity, collaboration, and critical thinking among future healthcare professionals. So HPV is more than just a topic in textbooks. It's a real and pressing issue that affects millions globally, with implications for cancer prevention, vaccination strategies, and sex health education. So they are to refresh your knowledge or gain new insights. Today's session promises to be both informative and impactful. Our speaker today is Hadyah Mwidau, a level 2 medical student at the University of Nairobi. Outside academic life, Hadyah enjoys reading, literature, taking leisure walks, and bike riding. So she brings a refreshing perspective and passion to today's topic, and we're thrilled to have her with us. So let's give her a warm welcome as she takes us through today's presentation. So welcome, Hadyah.
Thank you. Can you guys hear me? Just write in the chat if you can hear me.
Yeah, yes, I can hear you.
Oh yes, okay, you can hear me. Thank you. So thank you for taking your time to attend. I'm gonna be going through human papillomavirus as best as I can. So the human papillomavirus, that's an image of it on the side, comes from the family Papilloviridae. So Papova, PA for papillomavirus, PO for polyomavirus, and the VA for simian vacculating agent because they're the main members. Papilloma and polyomaviruses are oncogenic, and they are these viruses, they're non-enveloped icosahedral particles, as you can see the shape here on the side. Let me see, does this work? Yes, that's the icosahedral shape, and they have naked double-stranded DNA. The genome is comprised of 6 early genes, that's E1 to E7, but you notice there's no E3. And 2 late proteins, L1 and L2. The early genes, their job is transcription, DNA replication, and transformation, and the late genes are capsid proteins. Many of like the human papilloma viruses, we'll talk more about like their number in the next slide. Many of the human papilloma viruses have a genetic organization similar to that of HPV 16. To remember, the naked, double-stranded, non-enveloped viruses, which include papillomaviruses, you can use the mnemonic triple P ad, that's PPP ad, like an advertisement for something called triple P. So the first P is papilloma, the second is polyoma, and the third is parvovirus. And then the ad stands for adenovirus. So those are your naked, non-enveloped, double-stranded DNA viruses. And then some HPV virus types, because, okay, we're going to talk about this in the next slide. Let me go to the next slide. So HPV is a group of more than 150 related viruses, 40 of which cause genital infection. And HPV is the most common sexually transmitted infection. Risk factors are similar to other STIs, so lower socioeconomic status, concurrent STI, including other strains of HPV, multiple sexual partners, and also risk factors for HPV-induced cervical cancer include early age sexual debut, smoking, high parity, long-term use of estrogen, and HIV. So you can have just because you have HIV doesn't mean you'll have cervical cancer. You can have just lesions. You can have just the low-risk HPV strains that we're going to talk about in the next slide. So as I said, HPV is a very common infection. The cumulative risk of acquiring cervical HPV infection in women with only one sexual partner 3 years after their first sexual encounter is 46%. I haven't written it there, but yeah. So in women with only one sexual partner and they've been together for 3 years, the risk of them contracting HPV is 46%. And up to 80% of women will acquire an HPV infection in their lifetime. And as they get older, the probability of them clearing it decreases, because when they're younger, they can just clear it, be asymptomatic, and move on with their life. Yeah. HPV infection is more prevalent in young adults, that's 15 to 40 years of age, than in the elderly. Most infections are self-limited and asymptomatic. Some HPVs can cause genital warts. Those are the low-risk ones. That's HPV 1, 2, 4, 6, and 11. And other types can cause cancer and are considered high risk. That's HPV 16, 18, 31, and 33. Globally, HPV types 16 and 18, those are high-risk types, account for more than 70% of cervical cancer cases, and up to approximately 90% of genital warts. Those are low-risk HPV strains. Up to 90% of genital warts are caused by HPV type 6. Now, as you might have noticed, HPV strains below 15, so HPV 1, 2, 4, 6, 11 are low risk strains, and above 16 and above 15 are high risk strains. So anyone who has ever had a sexual encounter, even without penetration, can contract HPV. Most common transmission is by skin-to-skin contact with the penis, scrotum, vagina, vulva, or anus of an infected person. It can also be transmitted vertically from mother to child in the birth canal. So this diagram here shows how HPV can now cause cancer. This diagram over here, does my pen still work? Oh my God. I just went to the end. Okay, great. So this diagram here shows how HPV can cause cancer. So cancer is caused by high-risk HPV strains due to malignant epithelial growth. They contain the oncogenes E6 and E7. Remember those? Let's see, we can find E6 and E7. So they contain the oncogenes E6 and E7 that disrupt the cell cycle. HPV is associated with several cancers. That's cancers of the cervix, vagina, penile cancers, anal, and oropharyngeal cancers. Actually, the human papilloma virus is known. Some types of the human papilloma virus are known to be a necessary cause of human cancer. So like squamous cell carcinoma of the uterine cervix, anogenital cancers, penile cancers, laryngeal cancers, and oral cancers to some extent. So these, like HPV is a necessary cause of them. So how does HPV cause its problems? What am I doing? How does HPV cause its problems? So as you can see, normally you see that green arrow, that's how your cell cycle will normally progress, right? And it has like policing elements, like tumor suppressors, like police. They make sure that the cell cycle doesn't go out of control. But then E6 and E7, the oncogenes of high-risk HPV strains, they come and they inhibit them. So E6 is going to inhibit P53. E6 is going to inhibit P53, and E7 will inhibit RB. And then also it will inhibit P21 and another one which is not here, P27. But that's not its main job. So for you to remember this, you can like write them out. Let me write them out. You can write them out. So P53, check out the 5, and then E6, and then E7. Let's make it. Hey, what did I do? Sorry. Let's go back. So I was drawing. Where's this? You know what? It's fine. So I was trying to help you remember it. So to remember it, P53 with the 5 is inhibited by E6. And RB, if you write that B as a capital B, you can think of it as an 8, is inhibited by E7. So yeah, just to help you remember it. So in a 1995 study on cervical cancer by the International Biological, I don't know, I didn't write the end of that, by the International Biological, where more than 1,000 specimens of invasive cervical cancer were tested for the presence of HPV via a PCR-based assay, found that HPV DNA was present in 93% of the tumors, with no difference in presence across the 22 participating countries. HPV-16 was present in 50% of the specimen, and the other strains present included HPV-18, 45, 31, 39, and 59 in descending order of prevalence. So as you can see, HPV causes a lot of cancer. So this is the natural history of cervical cancer. So normally, if you're normal and then you get infected by HPV, you could clear it, especially if you're young, but then it might progress and then you get precancerous lesions, but it can still regress. But then at some point, if it continues progressing, it's going to invade your basement membrane, and that will end up in cancer. So you heard me talking about a basement membrane. This is slide 9. Okay. So you heard me talking about a basement membrane. That's because HPV infects the basal layer of your epithelium, right? And then, as you can see, let me see if my pens are working. Nope. As you can see, no, I want the pen. Never mind, the pen is not working. As you can see, it's going to invade your basal layer of your epithelium, and then the cells that it has infected will now start rising as they mature. So for example here, like you can see I've circled an infected maturing keratinocyte, and as the HPV continues replicating, it's going to destroy the cell cytoskeleton and end up forming these hollow cells that I've also circled there with a square. Well, circled with a square that I've highlighted with a square. So when the cytoskeleton of the epithelial cells is destroyed, it's going to form those hollow cells called koilocytes. Koilo means hollow. And eventually, these accumulating koilocytes are going to form an epithelial growth. So those are your lesions. But now, when it continues progressing, it's going to form like dysplasia in your epithelium. So the higher the dysplasia is, the higher the dysplasia piles up, the worse it is. So like when it's like iron 1 intraepithelial neoplasm 1, it's a bit more mild. When it's iron 2, it's getting worse, but it's still okay. By the time it gets to intraepithelial neoplasm 3, that's carcinoma in situ. And once it gets there and keeps on progressing, it's now going to invade your basal layer, and that's going to be cancer. So when it's just like precancerous, the plaques are going to be just red or white plaques on cervical and anogenital areas, and by the time they become cancerous, they become ulcerative lesions. We'll see them ahead. So here I have some pictures. So low risk lesions cause warts. Those are HPV strains 6 and 11. HPV strains 6 and 11 can also cause laryngeal papillomas. So laryngeal papillomas, you can get them either via transmission in the vertical transmission in the birth canal, or because of like other sexual behaviors. So laryngeal papillomas are also like vocal cord tumors because the epithelium there is stratified squamous, so it's easier for the HPV to invade and form the papillomas. So skin growths are usually small and rough. Genital warts often appear on the vulva, in or around the vagina or anus, or on the groin or cervix. But also now you have to be careful because sometimes the genital warts caused by HPV can resemble secondary syphilis. So as you can see there, it's comparing condylomata acuminata, which is HPV, with condylomata lata, which is secondary syphilis. The HPV warts are like fungating and like cauliflower-like, and the secondary syphilis are more of elevated plaques. That's something about HPV. You can notice even the papilloma looks like a cauliflower. There's a lot of it's I don't know, it's easy to identify. So then these are lesions also caused by low risk strains. The lesions are flesh colored, once again cauliflower-like epithelial growth. So these skin lesions are caused by HPV strains 1, 2, and 4. So the lesions, they're called verrucae. Verrucae refers to cutaneous warts. The lesions that you find like anywhere on your skin are called verrucae vulgaris. Vulgaris meaning common, but specifically the lesions that you might find on your foot are called verrucae plantaris, and verrucae plantaris are very painful. So these now are cancerous lesions caused by the HPV strain 16, 18, 31, and 33. As you can see, it's ulcerative, non-healing mass over there to your left. Yeah, so that's a squamous cell carcinoma. So now prevention. To prevent getting HPV, one way is abstinence. Also, you can have long-term mutual monogamy with a single uninfected partner, and a reduced number of partners, or with partners unlikely to be infected. Although we know that, as I told you in the earlier slide, even when you have like one partner, for example, to reiterate, even when you have, even with women who have had one sexual partner, the chance of them getting HPV 3 years after their first sexual encounter is still 46%. So yeah. You can also vaccinate against HPV the vaccines currently in use are Gardasil and Cervarix. This vaccine is recommended for ages 9 to 5 to people unexposed to HPV. So if you haven't gotten infected by HPV, it's recommended that between the ages of 9 and 25, you get vaccinated. Okay. So testing and diagnosis, a pap smear is recommended every 6 months to 3 years for all women post-puberty. But it has a high false negative rate. There's an estimated 2% of women only in Kenya who are getting regular pap smears every 3 years, although it's a bit higher in Nairobi, 4%. Other ways of testing a diagnosis is colposcopy, which is colposcopy with a biopsy, which is colposcopy is sorry, English has left me. They look at your cervix. The doctor looks inside your cervix. Sorry, English is a problem. Another way of testing a diagnosis is using acetic acid. The acetic acid turns precancerous cells of the HPV white, so that's the positive result, or just clinical inspection for warts because they are epithelial lesions. You can also do molecular tests for viral DNA. It's a very sensitive test. To treat HPV, as we said, most of the time it's cleared by the immune system, so there's no recommended antiviral, but some places use immunotherapies, that is E6 and E7 protein immunizations. One, you can have a radical hysterectomy when the HPV turns cancerous, or you can do chemotherapy or radiotherapy. The intraepithelial neoplasms, the precancerous lesions can be removed by freezing, laser, or surgically. Yeah, so that brings me to the end of my presentation. Here are my sources. Hey, it's totally refused. Yes.
Thank you so much, Ada, for that insightful, well-delivered presentation on HPV. You've really helped break down a complex topic. So, in addition to what Ada said, HPV remains a strong risk factor for cervical cancer, about 99% of the cases. And cervical cancer is the fourth most common cancer amongst women and is a leading cause of mortality amongst women. So remember, you can get an HPV vaccine. You can tell your sisters, your brothers, even men can get the vaccine. So Kenya offers a free vaccine program for ages 10 to 14 years at any public health facility. So just let your relatives, your sisters and family know. So we'd like to open the floor for any questions, comments, or reflections from the audience. So feel free to unmute yourself and drop a question in the chat. We'd love to hear your thoughts as we continue this conversation. So while we wait, I'm going to put up the couch session. Please don't leave. You can ask your questions while I put up the couch session. You can just unmute and ask any question. You can also add in the chat box if you can't unmute. If there are no questions, you can log into the Kahoot. So just go to kahoot.it, and then you can put in the game pin. The game pin is here, 3434838. Or you can scan the QR code. And give us time to join so that we can start the session. Can someone confirm my screen is visible?
Yeah, it's visible.
Thank you, Hadyah. So one person has joined so far. Welcome PV and Ari. Keep joining. I'll give us like 1 or 2 minutes. Then I'll close the. You can also share with your friends. Welcome Jem and Ian. Hey guys, join. Don't be shy, don't be shy. I'll wait for 1 more minute. Then I'll close the link. Okay, so I'll begin. So remember that the faster you answer, the higher the points, if it's the correct answer. So question 1, what are the oncogenes in high-risk HPV strains? Okay, the answer was E6 and E7. So most of you got this correct. Let's look at the scoreboard. So PV is on the lead, then Dio, and then Ari. So the next question, the true or false question. Most infection are symptomatic. Is it false or is it true? Okay, all of you got this correct. So it's true. Most of them are asymptomatic. So on the scoreboard, still the same, PV still on the lead. with Dio and Ari following closely. The next question. What is the recommended age to get vaccinated for HPV if unexposed? Okay. This was evenly shared. So 2 of you got it correct. The correct answer is 9 to 25 years. So on the scoreboard, now Ari has overtaken Dio in second place. PV still maintaining the first spot. So next question. What do HPV lesions most resemble? Cauliflower, spheres, strawberries, pits. Very nice. So that's cauliflower. I hope you remember the difference with secondary syphilis. So PV still on the first spot, then Ari, then Dio. Ian is on number 4. So next question, what type of virus is HPV? I hope you remember the formula. It's a nice mnemonic Hadyah gave. Yeah, so that was straightforward. It's naked and enveloped ES-DNA, double-stranded DNA. So PV still maintains the first spot, RI, and then Dio. So next question, approximately how many Kenyan women get regular pap smears? Okay, 2%, 4%, 10, 23. Okay, the answer is 2%. So as you can see, it's a very low number. So keep on sharing, keep on sharing. So PV 5663, then RI, then Dio. So next question. How often is a pap smear recommended to be for post-pubescent women? Is it yearly, every 5 years, biannually, every other year? Okay. So here is a multiple choice answer. So there's yearly, biannually, every other year, depending on their risk. So if you chose either of these, is correct, apart from every 5 years. Let's see. So Ari has been overtaken, Dio at number 2. Then PV still leading. Hey, PV. So true or false? Radical hysterectomy is a treatment for HPV. True or false? Okay, very nice. That's true. The treatment. Yeah, so question 9. What are epithelial cells destroyed by HPV called? Poikilocytes? Is it poikilocytes? Is it keratinocytes or condylocytes? Yeah, that's coilocytes. So let's hear the leaderboard. So PV still reading. Ian has managed to force its way into number 2. Then Dio and RI following. So true or false question. Damaged epithelium is the risk factor for HPV. Is it? Yeah, that's true. It is a risk factor. Remember, that's the last question. So at number 3, we have RI at 6594. Number 2, Ian with 748. And then number 1, finally, PV at 9440. So could you guys just, who is PV, Ian, and RI? We just unmute and say a few things. You get a chance to to share your thoughts on this session. PV, is PV in, Ian, or Ari? Any of you can unmute. Say a few words. Okay, Ndengwa is PV. Amazing. Amazing, amazing. So I'll stop sharing my screen. So I think guys, this has been fun. So thank you all for being part of today's session. Special thank you to our speaker, Hadyah Mwidau, for your presentation and everyone who participated in the Kahoot. So we truly appreciate you taking your time to join us today. So this has been part of the ZDZ Med initiative, and we look forward to bring more exciting and enriching sessions in the future. So until then, stay curious, keep learning, and take care of yourselves. So have a good day, everyone. Have a great evening and afternoon.